Welcome to Iswam Virtual 2021.
It is my great pleasure today to welcome all of you for today's session. We have learned so much in Iswam Virtual for the last 10 sessions, and now today we are entering our 11th session. Today's session theme will be about energy-based devices, the complete modality, and we will be having two topics for today. The first one is about double chin removal and lower face sculpting with micro-insulated radio frequency, brought to you by Dr. Matthew Holman from Australia. And the second topic will cover about A+ laser, painless, versatile 1450 nanometer diode laser, producing A+ result for acne, pores, and more by Dr. Rhee Do-young, PhD from South Korea. I'm sure that you are all very eager to learn more about double chin removal and lower face sculpting from Dr. Matthew. So now I will introduce us about Dr. Matthew. Dr. Matthew Holman from Australia is a graduate of Adelaide University and Flinders University Medical School. He has trained extensively in ophthalmology and eye surgery. He is board certified by the American Academy of Aesthetic Medicine and is actively involved in medical education, both as instructor and as a student. He has also held representational and advisory roles within his profession and is a medical advisor to Medical Insurance Group Australia. Now let us all please welcome Dr. Matthew. Good morning, Dr. Matthew.
Good morning, everyone. Thank you very much for the introduction and for having me. And good afternoon from Australia.
Okay. How are you today?
I'm well, thank you. I would certainly much prefer to be in Bali doing this live, but my kitchen will have to do for this time.
Okay. How are things in Australia now? It is one of...
Yeah, not too bad. We seem to have the virus pretty well under control here, but obviously things are, borders are closed, so we can't travel really anywhere, but that seems to be how we're controlling it. Yeah, how is it on your end?
In our end, things are still going up and up, so hopefully things will get better once the vaccination started.
Yeah.
Okay. We can't wait to hear what you want to present us today. I'm sure that everyone is very interested to learn about the double chin removal and lower face sculpting, as this is one of the most sought after treatment in our aesthetic clinics. Okay, yes. I will give you the time, Dr. Matthew, to present your course.
Thank you. Yes, so hang on, I get this working now. That's better. So yeah, as you said, I'm going to talk about the use of the radio frequency device for under chin fat and facial sculpting. But first of all, I'm just going to quickly just start on, just an overview of what the common concerns in the lower face are, and what causes these, the pathology, if you like, and what sort of treatments are available to us. But the main part of the talk is about the Agnes radio frequency device. And that's simply because it is probably 70% of what I do in the lower face because of how effective it is. But first of all, if we look at what it is that we're trying to treat, now obviously there's lots of things that cause cosmetic problems in the lower face. They can be genetic. People can just have a poorly defined jawline, usually because they're just a little bit fatty under the chin or in their cheeks. But they can also have some sort of more problems with their jawbone and their muscles as well. But probably in all areas of cosmetic, most of what we treat is related to aging. So it's that sagging and the wrinkling of the skin on the face causing jowls. We get a little bit fattier under our chin as we age, but also as we age, as you all know, we lose lose bone mass, particularly around our mandible, and that causes dislocation of the fat pads, again the jowls and under the chin. And when I'm trying to explain this to patients, I always use the analogy of if you have a cloth that's being held up by, it doesn't work so well with a virtual background, being held up by a frame. If you let that frame go, the cloth will fall down, and that's sort of basically what happens on your face, and that's why you get the sagging. It's not simply skin changes; it's also the sagging due to the lack of support under there. So when we talk about aging, specifically in the lower face, what is it? Well, it's a multi-layer change, as you know. So starting from the outside and working our way in, there's the skins, the textural changes, the thinning, the loosening, and the sagging. As we age, we do lose fat volume in the superficial fat pads in our face. So we get a little bit more skeletalized, and again, saggy because you don't have that volume to puff it out. But then, as I mentioned before, we get that significant bone loss, which you can see in the pictures on the right. You know, the mandible becomes a lot thinner, and the maxilla also, that volume loss in the central part there, causes loss of support and loosening of those the SMAS and those ligaments, downward dislocation of fat pads, causing jowls and under skin. So that's probably the main thing that we're looking at treating in the lower face. So how do we improve on it? Well, first you got to think about what is it that we're dealing with and what's the cause of it. I mean, I know that sounds a very simple, obvious thing to say, but it's surprising how often people don't think about that and sort of start from the other end and think, I've got these things, what shall I do with them? Meaning I've got botulinum toxin, I've got filler, where can I put it? It's much better to sort of think, what's the problem? Is the problem too much volume, too much bulk, or is the problem loss of volume? And actually treat it differently depending on what you do. That's where the Agnes comes in. And obviously, to get the best result, you want to treat the problem rather than sort of cover it up, I suppose. And in most cases, and I'll probably say in almost all cases, the problem is multifactorial. So you want to use a combination of therapies to get the best result. The key is understanding what each device or product that you've got can do, and use it to treat that and not to treat other things. So what are the things we've got? Again, this is not an exhaustive list. We're not going to go into it in any detail, but it's there because it's important, because it's all part of it. Cosmeceuticals, I think, are a very important, often underestimated thing. And by that, I mean a medical grade skincare with actual active ingredients, because having nice skin, bright, healthy looking skin is really crucially important to the outcome. So cosmeceuticals play a big role in my practice because of that. Toxin, usually it's more on the upper face, but it's very helpful in the lower face as well, because when you're looking about under chin bulk, it's not always just fat. Sometimes it is due to thickening of the platysma muscle or pulling of the muscle. So a bit of tox sort of in this area can really, really help to define the jawline. Also, the platysma muscle can pull down on the muscles on the face and create jowling. So just loosening that a little bit around there also can help to define the jawline. It's subtle, but it's useful and it does help. Of course, dermal filler and fat transfer, if the problem is loss of volume, you've got to put volume back. So that's the mainstay of how we do that. Thread lift's also very useful. Remember though that the thread lift doesn't treat a problem. All it does is just provide a temporary sort of lift of some tissues sort of further up, which can be helpful, but as I said, is not actually addressing the problem. It's not tightening skin. It's not debulking anywhere. And then, of course, there's the energy-based devices, and things like laser obviously are useful for skin surface textures and pores and stuff like that as well. But really, when we're talking about energy-based devices in the lower face specifically, we're mostly talking about skin tightening. So it doesn't really matter what device you use, they all work differently, but they all basically work by the same process, which is to elicit micro damage to whatever layer of the skin or face it is that you want to try and cause a healing response, get some collagen upregulation, skin regeneration, and depending on what layer you target, you're getting a different result. So if we look at the different layers, superficial layers, so the epidermis, now that's really for skin textural changes and improvement, etc. That's the plasma devices and the lasers. And you're getting a little bit deeper, you move into the shorter wavelength lasers, and the radio frequency devices, minimal skin tightening, sort of more superficial wrinkles. But again, the big area that we are dealing with when you're dealing with the lower face is that deeper layer to get that more aggressive skin tightening and debulking and lifting. So that's really the realm of the radio frequency needling systems, things like HIFU and Thermage. But specifically, when we're talking about the lower face, what is it that we want to look at? Basically, particularly with aging, it's about the dislocation of those fat pads and resulting in facial sag and contour irregularity. So areas like the jowls, etc., on the chin become more bulky, and other areas underneath the zygoma and further down the cheek, but can become a little bit volume deplete. And rather than a nice, OG curve shape, you can get it gets a little bit irregular. So the ideal energy-based device can debulk these areas and tighten, debulk and tighten, but also tighten other areas without causing fat loss where that's not desirable. You don't want further debulking in these areas. You only want it here and here. So pretty much all of these energy-based devices do a really good job at tightening the skin, but they also destroy fat and subsequently debulk that area. And again, that's useful in areas like this and this, but it's not useful if it's applied universally. And that's the problem we're seeing with things like some HIFUs and Thermage. Great skin tightening, but it's sort of global reduction of fat, which can be a bit skeletalizing and aging a few years down the track. So this is why the Agnes is my machine of choice, because it has the functionality to debulk targeted areas very precisely, and also and globally tighten skin as well without debulking that areas where you don't want that fat destruction. So it's a true surgical facial sculpting device rather than a skin tightening device overall. That's the machine. It's a very small machine. It's a very simple machine, but it's that handpiece you can see on the left that is what is so important about it. Tiny needles, very precise. You can be very accurate with this machine, and again, really sculpt with what you're doing. So how does it work? Well, the machine uses micro insulated needles, a series of different types of needles with different lengths and different amounts of insulation on the needles. And the needles don't actually do anything as such, but what they do allow you to do is target the radio frequency energy exactly where you want it to go and protect surrounding tissues and not put it in other areas. So you can protect the epidermis, which is very, very important because the machine is using quite high energy, and you would burn the skin and cause scars if it wasn't for the insulation on these needles. And more specifically, you can use even higher energy to debulk fat and not burn the skin, but also not affect other surrounding fat areas. It gives a very, very significant, but most importantly, a very natural result. And this, I think, is what I love the most about this machine. The result is always natural because it's that upregulation of your own face, of your own skin. It gives a really natural result. There's very little low risk of PIH with this device due to the insulation on those needles, meaning that the stratum basale isn't actually ever getting a direct RF energy. So it's a very low risk of that being a problem. So when you're looking at the skin tightening, there's a couple of different needles. One's called the W3B, Now that's W stands for wrinkle. It's a needle that was designed initially for around the eyes before we started treating the lower face with this machine. But it can certainly still be used on the lower face. And the advantage of that, again, is that you are just getting to the skin and you're not having that risk of debulking fat. There's another needle called the F3A needle, which is F stands for fat. So excellent for bigger areas where obviously you're treating the fat, and it can be used for skin tightening as well if it's used very carefully on an angle, which I'll show you a little bit later on. So as I said, it's the small needles in the small handpiece that allow you to be so precise and accurate with this. The epithelial integrity remains essentially intact because the needles are tiny and there's no radio frequency energy that is directly given to the skin. So it's a very safe treatment for that reason. It gets an excellent result for deeper wrinkles and skin tightening, and also, as I said, with that ability to target those fatty areas specifically. So this is just a little graphic of the needles. That's it's an outdated graphic. I'm sorry. There's some new needles that are there as well, but it just shows basically that they have different lengths and different amounts of insulation on them. And on the right, you can see a close-up of one of the needles. That's actually an acne needle. It's not something you'd use for skin tightening, but it just shows, you can see on the right the insulation of that needle on the base and about 1/3 of the way down, and the rest of the tip of the needle is the part that's active. So it's very simple, this machine. The key is you just always insert the needle all the way in. And that way you'll always be at the right level, you'll always be accurate and consistent, and as long as you insert it all the way in, you're not going to burn the skin. It's a safety aspect of it. And this is some little videos just to show the difference and the importance, I suppose, of the insulation on those needles. So on the left, it's a non-insulated needle, and they're going along treating that piece of tuna with increasingly high amounts of energy. And as you can see, that's causing very significant burns on the surface of that. And you see the one on the right, which is just lagging behind slightly than the one on the left. It's using the same power settings, increasing power settings, showing that even with very high power, which I think there's 2 more shots after this, that even with that very high power, you're not causing any surface burn. You're getting the effect of the radio frequency in a very precise location. I think there's one more to come. Yep, here it is. So this is a very high setting, which you'd see on the left has caused a major burn. Over here, no problems. The skin remains intact. And this is why it's important, really another reason why it's very important. We'll play this one. So this is actually it's actually under eye fat that's been taken out. And this is just to show what the machine is doing to the fat when you are using it for fat destruction. You're using extremely high energy. And this is what happens to the fat in the face when you're doing it. I'll keep playing it again if I can. You can actually hear when you're treating, you can hear the fat sizzling. So you know that you are destroying this fat. So that's obviously a very, very powerful, very powerful treatment that you could not do without the insulation on that needle. Because you imagine if it's doing that to the fat, what it would do to your skin if it wasn't insulated. Sorry. Okay, so now we've just got a few little before and after pictures with a bit of a story attached to it, I guess. This lady is actually my mum. She's the first patient I've ever tried lower face tightening on, and this is many years ago before the machines are updated with higher power settings and before we had that big 3 needle that you saw just before. So this is purely just skin tightening using the W3B needle. So there was no fat or no debulking or anything there. So what it did cause, I wanted to see whether it would work, and it did. It caused some nice improvement to the skin tone and texture and tighten things a little bit, but obviously didn't cause any major sort of skin tightening or debulking or anything. It was a very surface modality. So that's her whole face. Too far. And this is another patient that I did around about the same time that I think also got quite a nice result. I think that again, this was just skin tightening with that W needle. There's no debulking or anything going on there. And I think if you look at the pictures in the middle, the front-facing pictures in the middle, you can see how that aging, she's just getting a little bit saggy here, a little bit volume deplete under her zygoma as everything's sagged and gone south a little bit, and just causing a bit of irregularity. And by doing that, tightening that skin up, it's just pushed everything in here a little bit and bulked things up around there and just given more of a nice subtle curve. So I think sometimes the pictures don't show very well the result. I think the actual result when you see the person in person is better. It was a really nice sort of, somehow she just looked better. It was just a natural result. However, this picture sort of shows that because I didn't do any debulking of the jowl area, it wasn't a perfect outcome. It wasn't as good, as we wanted, which made me think, oh, we need to then sort of start looking at debulking that area. So that's the progression of how we went on. And this is a lady that is quite bulky. So I tightened her skin in the same way of the other two, but also used at the time an F1 needle, which is more designed for eyes, to try and target these areas to get some debulking around those areas, and specifically under her chin as well. You can see how it has really debulked and tightened up her under chin area, and also really defined her jawline. That you can see that in these pictures, and that's not shadowing or a result of different sort of photo angle. That actually has defined her jawline along there, and rather than that sort of really round fatty bulk that she had got. And I think the full face picture really shows it really nicely on her. It's given her a much more V-shaped rather than that sort of saggy, more masculine looking, I suppose, bulky jawline. So it worked really nicely on her. However, since then, Agnes has developed this needle, which is the F3 needle. So basically, because the machines are now more powerful, we're able to have 3 needles rather than 1. Makes the treatments a lot quicker, particularly when you're doing large areas like under the chin. And got some before and after shots here now. These are not mine, these are courtesy of Dr. Arn, showing just how well it works on that bulky under skin area. It just does seem to be, I think that's the best modality in the lower face, is the bulky patient, because it does so well to debulk the fat and also tighten the skin at the same time. And the tightening of the skin is really important, because I actually do see quite a few patients that have had the fat melting injections under there, which have worked, have got rid of the fat, but then they end up with a saggy little turkey neck. So then they have to tighten it with the Agnes machine. If you'd done it in the first place, you'd only have to have 1 treatment. And you can see how it's not just that debulking. It really does tighten and pull everything up. And improve that jawline and the neckline as well. And the other thing that's really good about it, and this patient shows it, is that because it's very precise machine, you can just target small areas, little bit of area on one side without having to worry about the other side, and get a really nice result from that as well. So it doesn't have to be big necks. It can be just a little bit here or a little bit here, and it works really nicely like that. And this, again, is a photo, a patient, Dr. Arns, but I always like showing it because I think it is such a fantastic result. I think he's a plastic surgeon in Korea, but it's just such a natural result from a non-invasive procedure, really beautiful, natural result. And I think this is the last picture, again, just showing just a targeted area under the chin. It's very small treatment, doesn't really take very long to do, and just get such a great result. And also remember that when you destroy fat, it's permanent. This fat is not going to come back. Obviously, if the person gets fatter overall, it will get fatter than that, but not back to where it was before. So this is something that is a really fantastic treatment because it's permanent. And this is a video of Dr. Arn demonstrating how to do the procedure.
I will show you how to make a marking for the jaw lifting and double chin treatment by Agnes. This patient had a setting on her radial fold and then jowl, and also she has a sagging with some fat on the double chin area, on the chin area.
So this is marking out where that jowling area is, where you want to get fat destruction there, but not the areas further up here. This is showing the area here. This is the area of the marginal mandibular nerve is the area, the only area really that you have to be a bit careful of when you're treating. You don't want to touch that nerve. He's showing now you putting the local anesthetic in. Obviously, that's very important that goes in. And if you listen, you can hear the fat being treated here. I don't know whether you can hear it or not, but. And this is using the 1-pin needle, again, using that for precision and accuracy around this area, so that you're only debulking the area you want without debulking other areas. Again, that's that area playing. Now with the larger areas under here, that's where you can use the F3 needle. And you don't need to specifically tighten skin when you're doing this, because the bulk heating from getting rid of that fat will also tighten the skin. So it's a very simple, straightforward procedure. And here he's showing just doing some skin tightening with that F needle on an angle. So basically, in my clinical practice, it probably does equate to, as I said, about 70% of what I do for the lower face, and that's because it's so powerful in its ability to tighten that skin and target fat pockets such as the jowl and the under chin, and then obviously you volumize with your fillers and you do Botox and stuff like that. But it tends to be a little bit of small print because of the major effect that you get from the radio frequency. And also it's a long lasting result. I mean, it doesn't wear off as such. The aging process goes on, but it lasts much longer than filler or a thread lift. Thread lifts, I think, is still great. And often what I use a thread lift for sometimes is if the patient wants a bit of an immediate result, because the radio frequency takes time to get the result. I mean, you really, I tell my patients, it's at least 6 months before you're getting most of your result. So what you can do is do the radio frequency, and sometimes a couple of weeks later, once the swelling's gone down, you do a little thread lift just to give them an immediate result while they wait for the effects of the radio frequency to come along. And then of course, the volumizing of some areas, the cheek and the zygone and the jawline as well. But it really is the radio frequency is the foundation of that lower facial sculpting. So in conclusion, it's a really unique modality, and it's very good around the eyes as well. It's so powerful. It's minimally invasive. There's minimal downtime. It's excellent. It's really doesn't really have much risk associated with it at all. And the thing I like about it the most is that it gets a really natural result. It always looks great. It's you are treating the problem, you're tightening the skin, and it just globally tightens that skin, and then you debulk the certain areas that you need to do, and you get a really nice natural result. And particularly also when you're looking at just doing the under chin in the younger patient that's got a bit of fat there, it's just the result can often blow people away. So as such, it's a major component of my clinic. And those are my contact details. And please feel free to message me if you want to ask any questions. And I hope you enjoyed that presentation.
Okay, thank you. Thank you so much, Dr. Matthew, for your wonderful presentation. We have seen some lovely pictures from before after the treatment. Now we will enter the question and answer sessions. For participants, if you have any questions, please feel free to write your questions in the live chat, and we will read it to Dr. Matthew so Dr. Matthew can answer us. This will be very valuable since Dr. Matthew has a lot of experience using this device. Okay, Dr. Matthew, we have one question in the live chat. It is from Dr. Kishanti. what kind of needle that we can use for infraorbital fat? Can this device also be used for the infraorbital fat? Maybe you can elaborate on this. Thank you.
Yes, absolutely. That was the first sort of modality of skin tightening that the machine was used was around the eye. Originally, it was designed for glandular things, treating acne, and things also like syringomas around the eyes. So basically, the progression was that Dr. Ahn noticed when he was treating people with syringomas that their eye wrinkles were getting better as well. So that's how then they thought, oh, well, maybe we can use this machine for skin tightening. So that's when they developed the W needles for treating around the eye. But some people also, as you asked the question, have infraorbital fat pads, quite bulgy fat pads. So simply tightening skin's not going to be enough there. So that's when they developed that F needle that I was talking about, that one pin needle that is called F for fat. And that's designed exactly for going into the infraorbital fat and doing that and doing very well. So when I showed you that graphic of the fat being shrunk by the needle, that was actually an infraorbital fat pad. So that's showing you exactly what it does. So it's a slightly different treatment than the way when you do the lower face, because it's a two-step thing. You need to, first of all, tighten the skin around the eyes with the W needle, and then you go into the fat pad with that F needle and physically destroy that fat. So yes, it's really is an amazing, unique machine, because it's surgery or Agnes is the only two things that can treat infraorbital fat.
Okay. And the next question comes from Dr. Maria Angelina. Good morning, Dr. Matthew. How about interval between the first and second session using Agnes on the same area?
Yeah, you'd probably want to leave it a good 2 months, I think. You don't want to, you're not really getting any extra benefit if you retreat too soon, particularly with the skin tightening. Give it time to have its result. To be honest, when I treat my patients, I tend to sort of try to do it in one session, and I try to encourage them not to come back or not to have a second treatment until 6 months down the track. However, there are two types of patients where I will say to them, we should just plan to do at least 2 sessions straight away. And that's the ones that have the really bulky neck or a really fatty under eyes, because you just know that you won't get all the fat in once. And then I'll get them back at the 2-month mark.
Okay. So how many sessions is it usually needed to get good results like the pictures you show us?
Yeah, look, as I said, I think you usually get pretty good results from 1 session. Obviously, you're going to get more with 2. Rarely would I do any more than 2. I think 2 is enough to get the really good results.
Okay. And another question from Dr. Kishanti. Can we combine it with HA filler? And how is the combination?
Yeah, absolutely. As I was saying, the machine, nothing does everything. So the machine will tighten skin and it can debulk fatty areas, but it doesn't add volume. So if you need to add volume, then obviously HA filler is the best way to do it. So absolutely, you combine it. You do it afterwards though. You can put the HA filler in before, but I think it's better not. It's better to do the treatment, and if you can, get the patient to perhaps wait until you get the result before you put it in. But if they're a bit impatient, just wait till their swelling's gone down. Usually, give them 2 weeks, and then you can combine it with the filler, and yeah, you get some great results. Also, with things like Radiesse, the calcium hydroxyapatite, it's got the filling, but the biostim as well works really well.
Okay. Like you said before, it takes time for this device to give results. Usually, how long does it take before patients can see good results and feel satisfied?
It varies a bit from the patients and a bit in what you're treating. If it's a fatty neck, often they'll see results quite quickly. You can see some form of result almost immediately, and a month down the track, they're starting to look really good. With the fat destruction, because you're destroying the fat, but you're not actually physically removing it. It's not liposuction. You can, at around about the 2-month mark, often get a second round of swelling, which bulks it back out again. It's swelling. It's just fluid. It's not fat. It's basically at the end of the inflammatory cascade, and then that's the fat's taken away through your lymphatic system, and then you start to get improvements again. So maybe at about a month they might see something, but really I tell my patients it's not really until 3, more like the 6 months, that you start seeing things. I think you do see some results a bit earlier, but if you make them to think that it's going to be later, then you don't get them coming back going, why is there no change?
Okay. Another question coming from Dr. Maria Angelina. Between using Agnes and Botox on neck area, which one should we do first, Dr. Matthew?
Again, it doesn't really matter. If you just can't do them at the same time. So often I will do some tox even the day before you do the radio frequency treatment. But really you can do it at any time, just not on the same day. You'd want to wait until the swelling has gone down, because you don't want the tox to run anywhere. But at any time. I've had a few people actually say to me when I've done the Botox after the treatment, they've said that, once that kicked in, it feels a lot more comfortable. It doesn't feel so tight under here. So, and they've suggested maybe it might be better to do the tox beforehand, might make it more comfortable. Don't know.
Okay. And another question from Dr. Ubeta. After how long should we repeat the next session? I think you have answered this before, but maybe you can repeat it again.
Yeah, leave it at least 2 months. Don't treat any earlier than 2 months. Ideally, I like to see the full result before I retreat, so I don't like to do it before 6 months. But if the patient's very keen for more sessions, or they are quite fatty, so that they're going to need more, anywhere from 2 months on.
And in your presentation, you said that this treatment is quite long-lasting. How much is the duration of the long-lasting you are describing?
Well, I mean, look, it doesn't wear off. The aging process goes on. It's just like surgery. The moment you walk out of the operating theatre, the aging process goes on. But you reset the bar. So I think I've really only been doing the lower face for maybe about 3 years. And, obviously people are still better, but with the eyes, some of my patients that I treated 6 years ago are still looking better now than they were 6 years ago. Yeah.
Oh, without using surgery, and it lasted years, it is very promising. Yeah. Okay. And you said before that this is quite different compared to HIFU. If we use HIFU only in the chin area and just where it is the debulking of fats is indicated, how would you say the difference between the melting of fats while using HIFU or using the radio frequency method you just described?
Look, I think the Agnes is better because it's far more aggressive. I mean, HIFU, it's much more simple. I mean, you don't need to do the anesthetic injections, just and you can do a few sessions and get a really nice result as well. Whereas this, as you can see from the video of what that energy physically does to the fat, you can go into the chin, target exactly where you want to go. Very high energy. You are frying the fat, so you're getting and you're tightening the skin as well. So you're going to get probably a much more aggressive, a much better outcome. Having said that, you probably still could achieve it with HIFU, which just take a few more sessions.
Okay, so it gives faster results compared to HIFU.
Yeah.
And this is another question from Dr. Kishanti. Can it also work for stretch mark, Dr. Matthew, the Agnes?
Look, it can help, but stretch marks, as I'm sure you know, are notoriously difficult to treat. It can help, it can improve, but it's improve. It's like acne scars. It can help it can improve it, never get rid of it completely.
Okay. And another question from Dr. Maria Angelina. Is it indicated for patients who have a tendency for keloids? Can we use this device?
Yeah, you can, but you certainly should be very careful. As you know, you're always careful with patients that have a tendency for keloids. I mean, keloids are very rare on the face, obviously. So you know, you can, but yeah, you'd be careful.
Okay. Any precaution message maybe if we have patients with tendency for keloid interested in using this device?
Very carefully make sure you insert the needle all the way. I mean, obviously, a keloid scar is at the level of the dermis. So if you're not causing problems in the dermis, you should be okay. So if you're using those F needles that go well beyond the dermis, it should be fine because you're treating the deeper layers. I probably wouldn't use you know, target the dermis specifically because that might cause problems. And certainly you just want to make sure that you're really careful to insert that needle all the way in so that you don't cause any burns on the skin that's going to start a scar process. And you know, if the patient's okay with having needles inserted in their face and that doesn't cause keloids, then they should be okay as long as you're not giving the radio frequency energy to the skin.
Okay. Okay, I hope that will answer all the questions. If the participants have some more questions, please feel free to write down your questions on the live chat and Dr. Matthew will answer it for all of us. Okay, Dr. Matthew, you said that you like to combine this treatment with thread to give more defined lifting. What is usually your planning time for the patients? Like after doing the thread or maybe doing the micro-insulated RF first, maybe you can explain us your usual approach for the patient.
Yeah. Well, this is one where you absolutely need to do the radio frequency first because you don't want to go in and do a significant radio frequency treatment that causes swelling when someone's got a thread lift there because you know, you probably drop the thread lift and probably drop it asymmetrically and not look very good at all. So definitely do the radio frequency first and allow the swelling to go away. So give it at least 2 weeks and then you can do the thread lift to pull things up. And then the hope is that as that, you know, thread lift, you know, maybe 12 months, it's gone, maybe sooner. Hopefully by the time that's gone, the radio frequency is starting to have its effect.
Okay. If the patient come to us already having a thread lift before, can we still do this treatment?
I wouldn't, and I don't. I do have people that come and ask that, and I just think that that's probably asking for trouble because, as I said, if they've got a thread lift on board and you go in there, you're going to release some of the threads, maybe not all of them, and they could end up with a strange result. Yeah, I think that I make patients wait until the thread is worn off before I do that.
Okay, so I think it is a very important question to ask before we do this treatment because sometimes people go to many different clinics and they do a lot of other treatments. Okay, so your suggestion is that we wait for the thread lift to be gone, like for around 1 year, maybe the safe treatment. Okay.
Yeah.
And then only we can do the radio frequency treatment. Okay.
Yes. Yeah.
Okay. And we have one more question coming in the live chat from Dr. Maria Angelina. Dr. Matthew, can we do mesolipo injection before or after using the Agnes? Can the mesolipo injection help or is it needed?
You can do it. I don't really know why you need to though, because the Agnes is going to treat it anyway, and you can be much more specific with where you're putting it because obviously it's the needle. The needle goes exactly into the part of the fat that you want to dissolve, and you saw what it does in there, in that video. So yeah, using the fat melting injections, there's no reason why you couldn't, but I don't think you need to.
Okay.
I think it would be overkill.
Speaking about the mesolipo injection, in your experience, how is it compared using the mesolipo injection to melt away the fats than using this radio frequency method?
I think the problem with the fat melting injections is that it doesn't get much skin tightening. So when you're doing fatty under chin areas, it does work nicely to get rid of the fat in most people. And remember that there's a proportion of people that the fat melting injections don't work on at all. Everyone the Agnes will work on everyone. But I think it's better than the injections because it tightens the skin at the same time. And usually often you only need one session, whereas multiple sessions with the fat melting injections.
Okay. Because mesolipo injection is quite common here in Indonesia. Yeah. Is it common there in Australia?
Yeah, it is. It's perhaps getting a little bit less common than what it was, because, as I said, people are noticing that they're just getting saggy. They're losing the bulk, but they get saggy skin, and it's just swapping one problem for another. So it's becoming less useful. I think a lot of people that don't have, the Agnes machine are often finding that what they do is they use the fat melting injections. Then they've got to go back later and do a whole lot of sessions of HIFU to try and tighten the skin up.
Another device for skin tightening.
Yeah, so it ends up, the cost just ends going up and up and up, and time goes on, and it's multiple, 3 sessions of fat melting and 3 sessions of HIFU. Yeah, it works, but it just takes longer.
Okay. And another question from Dr. Ubeta. This is concerning the technique for the treatment. Can we use topical anesthetic for the treatment, or do we have to use the injection of local anesthetic?
Yeah, you really do need to use the injection because you're treating quite deep, and the topical anesthetic will only sort of numb the skin surface, not deep enough. So yeah, sometimes if you're treating the eye area with the really shallow W3A needle, some patients can tolerate it with just numbing cream, topical anesthetic. But yeah, once you start going deeper and anything in the lower face, you do need the injections.
So the injection is needed to comfort the patient, yeah?
Yeah,
because you're going
you're going quite deep. The needle's going quite deep into the SMAS and into the fat. Topical anesthetic just doesn't penetrate deep enough to numb down where you're treating.
Okay. And still concerning the method, doctor, okay, there is no more questions on the live chat. With the experience that you are having using the device, can you share us about the patients sharing on the swelling? Like, how worst is the swelling, and is there anything you can do to fasten the swelling to go away?
The swellings are usually not too bad, particularly in the lower face. Patients usually don't really have too many problems at all. They're not too worried about it. I mean, the skin is quite thick here. The area is quite big. So the bulk of the swelling is gone within 2 days. And yeah, look, it's still there maybe for a week or two afterwards. The patient themselves might notice it, but no one else really notices it. So it's not a problem. You get the occasional patient that seems to swell more than someone else, and they notice they're just a little bit chipmunky here. But really, on the whole, probably 2 days, and the swelling's not noticeable and doesn't bother people.
Is there any take-home message, like should we give anything to reduce the swelling? Cold compress, any medication?
Yeah, definitely ice. So when I treat the patient, I always leave them there with ice for 10 to 15 minutes before they leave my clinic, and I send them home with some ice packs for them to keep icing 10 to 15 minutes every hour for the rest of that day, and maybe even the next day, depending on how swollen they are. But that's all I do. I don't give any prednisolone or anything like that, because I think that, first of all, it's overkill, but also you want a bit of inflammation, because that's what's causing the skin tightening. So you don't want to dull down that swelling completely.
Okay. Is it painful from the testimony of the patients?
No. Obviously, the local anesthetic injections sting a bit when they go in, but once that's in, the procedure's completely pain-free, and they don't really even know that you're doing it. It's not painful afterwards. No one's ever complained of any pain. I don't think anyone's even ever taken any paracetamol or anything for it. They say you feel a bit bruised and swollen, but it's not painful. And you have some funny sensations for a while afterwards because you get a bit of a temporary neuropraxia of the skin, and that can last often even up to 6 weeks sometimes. It's not painful. It's just a bit strange when you touch the area. Always goes back to normal, always.
After 6 weeks, yeah, usually.
Yeah.
Okay.
Yeah.
Okay, we have some more questions on the live chat, Dr. Matthew. Can it be treated on the upper face area, like, for example, the forehead?
Not really, because the problem with the forehead is it literally is just skin, muscle, and bone. There's no real sort of subcutaneous tissue plane that you can treat to get some tightening. I think I have tried it. It does get a little bit of improvement of skin,
Wrinkles.
but not very significant. Probably not to the point to necessarily bother. It works best where you've got a little bit of laxity to get that skin tightening, or you've got some bulky area to get rid of. The eyes, for example, is an excellent area for it because the skin is so thin and it's not really tethered to anything, so you get really powerful skin tightening. Whereas here, it's because it's so thick and it's so strongly tethered, you don't get a huge reaction.
Okay, so for wrinkle purposes on the forehead, this is not indicated for
really.
that kind. Okay.
Yeah.
And talking about the eye area, you said that this works well also for the infraorbital fat pad. Can we also use this for the upper eyelid fats? Because we have many people in Indonesia with that kind of problems.
Yeah, you can. You use you treat the sort of the lateral half of it. You don't want to go into the medial part, but mainly because it's a danger zone. You've got the infraorbital nerve, you've got the supratrochlear nerve that's right under the skin. You can't really see it, but also because you don't really want to debulk this area anyway. Mostly sort of aging parts, this is where you lose volume. It's here, it's the lateral part, and you don't need to go in with a needle, like a fat needle, to melt the fat. You just do some skin tightening there, and because it's not so much so you want to get rid of bulk in the upper eyelid. You want to tighten it up. You want to keep volume there, but you want it to tighten up. So it works really well there as well.
Okay. And in your experience, what kind of cases that you have experienced the most using this device? For which area?
Probably, look, I probably still do more eyes than the lower face. It's increasingly lower face, but I've been using it on eyes for longer. So the lower face is a modality that we've developed more recently.
Okay.
Yeah.
And for the eyes, we also use the same protocol, like 2 months apart, and the result will also be seen after 6 months, or is it faster because of the less fats there?
It probably can be a bit faster, but I still tell people 6 months for it as well. Yeah.
Okay. So with this device, we have to educate the patient to be really patient. Yeah.
Yes, exactly. Yeah. And that's a very good point that you brought up. It really is about educating the patient to understand that there will be some downtime, but it will settle, it will all go away, and that result takes time, and you've got to wait for that result. And as long as they understand that, they're usually pretty happy to go forward with it.
And they are usually long lasting, like we are talking about results in months and even in years without having to go through under surgery.
That's right. Yeah.
In your experience, what is the fastest that the patient wants this treatment back or requires this treatment back?
2 months. 2 months. I won't do it any sooner than 2 months, because I think you need to. You got to give the treatment time to have its full effect, or to actually get the result from that. If you treat any sooner, you're probably you're wasting it, because the inflammatory cascade is going on for about 2 months. If you cut it short, you're probably restarting earlier than you need to. So 2 months.
2 months apart. Once they get good results, how the fastest that it can last in your experience, how long? Like you said, you have patients being happy for for 6 years, for more than a year? What is the fastest that they feel like, oh, the result is gone already?
Well, I don't. Of those patients, none of them have come back for a redo years down the track. I mean, probably those first patients, the 6 years down the track, probably could do with some more to make them better. But as I said, they're still looking better 6 years down the track than they were before. I think I've lost my. I can't show you the presentation again, but the pictures of my mum. I did her eyes, her upper eyes, and yeah, she's 6 years down the track and still looks way better than she did before.
Oh, okay. That is a very interesting point and a very encouraging thing to use this device, yeah? Because sometimes with non-surgery, it is very hard to give a very long-lasting result that our patients desire.
Yeah.
Okay. Oh, this is another question. I think we still have time for one more question, Dr. Matthew.
Mm-hmm.
Okay. From Dr. Ubeta. How many millimeters apart for every injection point using the device on the infraorbital fat pad? And how long the edema on the infraorbital will disappear after the treatment?
So do you mean the space apart for the anesthetic or for the actual using the F needle?
The F needle.
Okay. Probably, every sort of, probably about 3 to 5 millimeters apart. But it really is a case of you look where the fat is and you treat, and then you come back and treat a little bit more. And you can actually see the fat pad going down. So, you can see it in front of you. And as far as the swelling goes, it is a little bit longer lasting in the eye area. Again, because that skin there is so thin and it's not tethered, any swelling you have is a lot more obvious around the eyes than it is on the lower face. Again, though, most of it's gone after 2 days, 48 hours. There is still some swelling there that, again, the patient will notice, but mostly other people don't. So if I treat a patient on a Friday, usually by Monday they can be back at work, and they might have some bruises that they cover up with makeup, but essentially, mostly people don't know.
Okay, so they won't look on Monday like they have been crying throughout the weekend, yeah?
Yeah. No, usually the eyes are fine. They can be a little bit red and, as I said, have some bruises, but that's usually pretty easily covered up with makeup. And most of the swelling's gone after that 48 hours.
Okay, so we have come to the end of our time. It's 11 already, and we are sad that we have to say goodbye to Dr. Matthew. It is very interesting to see your presentation. And what's most interesting is that you told us that this gives very long-lasting results, and that is very, very good point. We thank you so much, Dr. Matthew, for sharing with us your insights and your precious knowledge today, this morning. And also thank you for answering all our questions and very elaborately explaining to us about the advantages of using the micro-insulated radio frequency device for the debulking of fats.
Yes, thank you very much for inviting me to speak. It's been great, and thanks for the questions. They were all really good questions too.
Yeah, hope to see you again,
yes.
And maybe we can meet again in Bali, like what you said.
Yes,
Okay.
let's hope so.
Stay safe, Dr. Matthew.
Thank you. Same to you and everyone there.
Yeah. For the participants, after this session, we will have a little commercial break before we go to the next topic for today's session. Okay. Goodbye, Dr. Matthew. Have a nice day.
Thank you. Bye-bye.
Bye. Good morning, dear participants. We are now in our second topic for today's session. The second topic will be about A+ laser, painless, versatile 1,450 nanometer diode laser, producing A+ result for acne, pores, and more. This topic will be brought to you by Dr. Rhee Do-young, PhD from South Korea. Dr. Rhee is a graduate from College of Medicine, Seoul National University, and also from the Graduate College of Medicine, University of Ulsan, South Korea. He is a resident in the Department of Dermatology in the Asan Medical Center, Seoul, Korea, and a clinical fellow from Asan Medical Center, Seoul, Korea, and now is a director in Leaders Clinic, Seoul, Korea. Please welcome Dr. Rhee Do-young. Good morning, Dr. Rhee.
Good morning, everyone.
How
Thank you
are
for-
you?
Very good. Thank you for inviting me to this Iswam 2021. And I'm very happy to share my experience of one of my favorite device in my clinic.
Okay.
Yes.
It is nice to have you here, and we already can't wait to hear your sharing and learn more from you about this laser. How long have you been using this laser, Dr. Rhee?
I've been using this for like a year and a half. So yes.
And this is now the most favorite device in your clinic?
One of
One
them.
of, okay, one of them. Okay.
Yeah.
Now we can't wait to hear all about it. I'll give you the time to present the presentation, Dr. Rhee.
Okay. Thank you.
Hello everyone. I'm very happy to share my experience of one of my favorite device in my clinic, A+ laser. It is very comfortable, painless 1450 nanometer diode laser that you can use for various indications like acne, pores, textures, and more. I am Do-young Rhee from Leaders Clinic Seoul. And this lecture was sponsored by MedMix. In this lecture, I'll briefly talk about the 1450 nanometer laser, pathogenesis of acne, 1450 nanometer laser for acne treatment, paradox of dynamic cooling device, DCD, and characteristic features that A+ laser has, and I'll show you the clinical photos. First, I'll talk about 1450 nanometer wavelength. For the 1450 nanometer wavelength, the principal chromophore is water. And this wavelength has affinity to fat as well. The 1450 nanometer diode laser was first developed for non-ablative skin rejuvenation, that it targets dermal water and hits dermal tissue to stimulate collagen remodeling while sparing the epidermis. And then, it has grown in popularity to treat acne. And let's have a look at the pathogenesis of acne. And it is well known that excessive sebum production is one of the key factors to develop acne. And when you have a look at this paper using Thermocool, the former version of the Thermage, which is one of the most famous non-ablative radiofrequency device for rejuvenation, Thermocool was used for the treatment of active acne, and the representative photograph indicates the decrease of active acne lesions, and all 22 participants showed marked decrease of active acne lesion counts. And it can be called as thermal therapy, that after radiofrequency treatment, quite high amount of deep dermal heating was generated, which impaired the activity or the destructed sebaceous gland, and this results in improvement of active acne lesions. And the 1450 diode laser with DCD, it has penetration depth around 435 micrometer, and the maximal thermal damage is around the depth of 150 to 200 micrometers. Considering the sebaceous glands are located at depth about 200 and 1000 micrometers, the 1450 nanometer wavelength can affect sebaceous gland activity. And after irradiation of 1450 diode laser with DCD, you can see thermal necrosis of sebaceous glands and sebocytes, and necrosis of follicular epithelium. And when we thermally damage sebaceous gland, it will directly regulate sebum secretion, regulate some of the enzymes, and indirectly downregulate local inflammation. And another key factor to consider is inflammation. There was an interesting paper on JAAD. The authors took serial photographs to analyze the lives of the acne lesions. And what was interesting was that 3 out of 10 inflammatory lesions come from normal appearing skin, de novo. And on a report that inflammatory events are involved in acne lesion initiation, you can see not only the acne papules, but also the uninvolved acne skin, the normal appearing skin, even has inflammatory cell infiltrate. And those inflammatory cells are T cells, mostly memory T cells. And another key factor to consider is alteration in keratinization. And this is histology of microcomedon, and it is the earliest subclinical acne lesion characterized by hyperproliferation of the follicular epithelium. And the sebaceous gland produces various cytokines such as IL-1 alpha, beta, TNF alpha, IL-6, IL-8, and it attracts inflammatory cells. And IL-1 alpha induces hyperkeratinization of hair follicles. And this increase of IL-1 alpha is observed in uninvolved skin, the normal appearing skin as well. And that is to say, when the patient has acne-prone skin, subclinical inflammation has already begun in the normal-looking skin as well, and the whole face has potential to develop acne lesions, like this, a minesweeper. And that's why we should try to treat the whole face, even if it doesn't have any signs of inflammation yet. And from now on, I'll review several reports dealing with the treatment of acne with 1450 diode laser. And most of the studies were performed with smooth beam. And considering the long-term effect, after 1450 diode laser treatment, all patients had reduction in acne lesion counts, and the reduction were well maintained at 12 months follow-up visits. And even though it has a good efficacy, one of the limitations of 1450 diode laser treatment would be pain. And when using high fluence of 11 to 14 joule per square centimeter, the patient scored pain as 6 to 7, even with the application of topical numbing cream. So, if we compare single pass high fluence versus double pass low fluence treatment, reduction of acne counts were comparable, 78% to 67%, while the pain score was quite different, that average score of 5.6 to versus 1.4. So the double pass low fluence technique is proved to be effective, less painful, and better tolerated. And I'll talk about the paradox of DCD, dynamic cooling device. Dynamic cooling device is used to spare the epidermis from burn, and as you can see, without dynamic cooling device, both the epidermis and upper dermis are thermally damaged. And with dynamic cooling device, the epidermis is preserved and the thermal damage is confined to the upper dermis. And there is a paradox. Even if it is intended to spare the epidermis from burn, but sometimes it has a risk of burn and a risk of post-inflammatory hyperpigmentation because of the DCD itself. And when we have a look at the cutaneous effect of cryogen spray cooling on in vivo human skin, the observed skin changes include erythema, urticaria, blistering, hyperpigmentation, and hypopigmentation and scarring. And the hyperpigmentation, although it was reported to be transient and resolved spontaneously by 8 weeks without any medical treatment in this paper, but there are many reports of cryogen-induced arcuate-shaped hyperpigmentation after 1450 diode laser treatment, most of them with smooth beam. And the reason for this side effect was lack of epidermal surface cooling related to DCD misalignment. And look at the test shots on black paper showing the arcuate burn reactions. And once this kind of side effect occurs, it is very difficult to treat. And both patients were given hydroquinone cream and 1064 nanometer Nd:YAG laser toning treatment with gradual fading over 3 months, but neither case was completely resolved. And this is another case which was refractory to hydroquinone cream and vitamin C iontophoresis. And the hyperpigmentation became even darker with consecutive QS Nd:YAG laser treatment and QS Alexander laser treatment. And this patient was finally treated with Starlux, the 1540 nanometer fractional laser, which fortunately achieved fading of hyperpigmentation. This was a lucky case, but in case of Southeast Asians who have darker skin type than East Asian populations, should be more careful with the use of DCD because it will even more hard to treat if the hyperpigmentation ever happens. And this is an interesting paper by a Japanese group regarding the 1450 laser treatment in Asians. It is of note that PIH was not observed in any of the patients, and the authors speculated that low energy and short duration of DCD spray, 20 milliseconds, are the reasons for the lack of PIH in this study on Asian patients. So, DCD is like a double-edged sword that it is intended to spare the epidermis, but sometimes it paradoxically damages the epidermis. Then, what if we remove this CD from the 1450 laser? Then, can't we be free of the side effects? And we can get a hint from a treatment method called laser toning. And this method is 1064 QS Nd:YAG laser treatment for the treatment of pigmentary disease using collimated beam, large spot size, low fluence, high frequency with multiple passes. And you can see the decrease of melanosome and the functional impairment of melanocyte presented as loss of dendrites. And this is a paper by my fellow Korean group comparing conventional high fluence stamping mode to low fluence stamping mode only for the treatment of inflammatory lesions, and additional 4 to 5 passes of toning mode without DCD. And the dual mode of both stamping and toning mode offers better effects for both inflammatory and non-inflammatory lesions. And not only the reduction of active acne lesions, but also the decrease of sebum secretion was noted, greater decrease on dual side mode. So the toning mode, yes, it works. And this study indicates that relatively longer exposure with low fluency energy, multiple passes, the toning mode, may effectively decrease sebaceous gland activity compared with lesion-only based approaches. And the toning mode may be beneficial to modulate excessive sebum secretion and treat non-inflammatory acne lesions compared to the conventional mode. And here I introduced A+ laser, a high frequency 1450 nanometer diode laser without DCD. And these are the features that A+ laser is optimized for toning mode treatment. It has large spot size, which is 8 millimeter, high power up to 16 watts, high frequency rate up to 50 hertz, and as it doesn't have DCD, it doesn't have any consumables, and this device has minimal risk of side effects such as arcuate hyperpigmentation. And it has two changeable tips, the toning tip and the spot tip. And toning tip has diameter of 8 millimeter. It is used to treat the whole face with low fluence and high frequency rates, multiple passes with motion. And it has good effect on inflammatory acne, sebum control, textures, and pores. And spot tip has a diameter of 1.5 millimeter, and it is used to treat spot lesions with relatively high fluence and low frequency rates. And it has good effect on comedones and sebaceous hyperplasia. The toning tip has large spot size that it has advantage of faster procedure time and deeper penetration of laser radiation. An A+ laser has high power up to 16 watts and high frequency rate up to 50 hertz. And high power is essential to maintain proper fluence even with the large 8 millimeter spot size, and this enables fast and effective tissue heating. And this is my protocol. First, I treat with the toning tip, the toning mode with motion, whole face up to 1,600 joules. And then I treat inflammatory lesions with toning tip and stamping mode. And then I treat comedones with spot tip, stamping mode if it is necessary. And I'll show you the clinical demonstration that I have done. I did A+ laser treatment every week with the total energy was from 1,000 to 1,600 joules. And I injected triamcinolone if needed. And after A+ laser treatment, the patient was irradiated with SmartLux red and blue light simultaneously. And each visit, I measured transepidermal water loss to evaluate if this laser will make skin dry. And let's see the clinical photos. And this is after one session of A+ laser and SmartLux treatment. 2 sessions, 3 sessions, 4, 5, 6, 7, and 8. And the other side of the face, 2, 3, 4, 5, 6, 7, and 8. So after 8 sessions of A+ laser and SmartLux laser treatment, you can see the inflammatory acne lesions have reduced, and erythema following acne lesion has improved, and some of the atrophic scars are improved as well. And look at this radiant, more brighter skin tone and texture. And the transepidermal water loss was within normal limit throughout the treatment sessions. And this is what the patient commented about the treatment. Clearly, I have less pimples than before. The treatment was less painful than extracting comedones, although it was very hot. And the skin has become brighter and smoother, and I am satisfied with the result. And another case, please focus on the comedones on the forehead. 1 session, 2 sessions, 3 sessions, 4 sessions, 5 sessions, and 6 sessions, and the comedones wax and wanes. And after 7 sessions, the comedones are improved, and 8 sessions, and after 9 sessions, comedones are much more improved. And you can check it on the other side of the face as well, that 2, 3, 4, 5, 6, 7, 8, 9. And this photo of the whole face after 9 sessions of the treatment, the texture and pores improved and the overall skin has brightened. Confirmed on the other side as well. So this is what the patient commented about this treatment. The sebum secretion has decreased following 4 to 5 consecutive treatments. Comedones on the forehead improved with repeated treatments. And after spot treatment for the comedones, redness lasted for a week and couldn't feel the dryness after the treatment. And this is another male case. And he commented they used to have a lot of pimples during summer season, but not this year. And the skin texture was rough when I first started the treatment, and it gradually softened. And this is a case of young female patient. And this is what the patient commented about the treatment. Less pimples come out. But pimples still come out during menstrual cycle despite the laser treatment. And skin texture has improved that the makeup is applied more naturally. And this is an important point for the female patient to be satisfied with the treatment. Another case, male case, and he said inflammation and sebum secretion failed to be decreased after 2 treatment sessions. And the treatment seems to be better than taking 1 or 2 pills of isotretinoin. Very impressive. And this was a very interesting case that you can see the improvement of fine wrinkles around eyes after 9 sessions of treatment. And the texture has improved. And this was what the patient commented about the treatment. Friends praised me of getting brighter skin. Friends asked me if I had Botox treatment. And felt my overall skin elasticity has increased. It drifts to a lesser extent. And this is another case of middle-aged female patient. And after 9 sessions, the skin has become more radiant. And the patient said could feel immediate softer skin on the evening of the laser procedure. I rarely had pimples during the summer, even though I used to have them every summer. And sebum secretion has decreased without feeling of dryness. And skin texture has improved a lot. Unfortunately, not all the patients respond well to A+ laser treatment. And this patient was one of the poor responder to the treatment. And even after 9 sessions with the treatment, the acne lesion kept coming out. That she was a show host of one of the home shopping channel in Korea. So she had to wear heavy makeup, cleanse vigorously every night to remove the makeup. And as you can see here, she has relatively high transepidermal water loss, indicating she had impaired barrier function. And what she said about the treatment was new lesions quickly goes away with the treatment. Pimple still comes out around ovulation period. Relapsing ones tend to come out again and again and have lighter makeup than before. And the comment about this makeup is quite consistent that the A plus laser treatment has advantage to have easier, lighter, natural application of makeup, and it can be a sales point. And I'll talk about the combination treatment. And this is after single treatment of A plus laser and high frequency ultrasound immediately after the laser treatment. And you can see the rapid improvement of inflammation and of acne marks. And note the rapid reduction of erythema. And this is another case of combination treatment of A plus laser followed by high frequency ultrasound. And improvement of acne inflammation is rapid. And with the consecutive treatment sessions and with the combination of laser toning and picosecond laser treatment, reduction of acne lesions. And you can see improvement of skin texture and reduction of facial pores as well. And the development of facial pores, it is closely related to the increase of sebum secretion and the decrease of skin elasticity. And 1450 diode laser can reduce sebum producing follicles and total sebum production, thereby decreasing facial pore size. And this is a patient treated with 2 sessions of A plus laser and laser toning. You can see the decrease of porphyrin on the UV photography and decrease of pores as well. And combination of picosecond fractional laser with A plus laser and oral isotretinoin can have good clinical outcome as well. In summary, these are the benefits of A plus laser. First, A plus laser can minimize the use of daily medications as it can reduce the new acne lesions coming out. And second, the clinical response is quite fast, that with 2 or 3 treatments, the patient feels their skin is getting better. And third, it has good compliance because the treatment is almost pain-free and it has additional skin rejuvenation effect. And it has synergistic effect with other energy-based device for better clinical outcomes. So, what is the feature that the ideal laser should have? And I think it should be effective, versatile, safe, and economical. And the A plus laser is effective, although it has minimal pain and downtime. It is versatile that it can be used for various indications like acne, sebum control, pores, and more. And it has synergy with other laser devices. And A plus laser is safe because it has limited side effects and is economical because it doesn't have any consumables. So the A plus laser is acne plus laser, that it provides A plus result to acne, pores, textures, and more. Thank you for your attention. Hope you stay safe and healthy during this pandemic and hope to see you offline next year. Thank you. 자, 이제 시술을 시작을 할게요. 오늘 할 시술은 A 플러스 레이저라고 하는 레이저고 얼굴 전체를 좀 부드럽게 열감을 주는 정도의 그런 치료라고 보면 될 거예요. 자, 일단은 시작하겠습니다. 저는 지금 220ml줄에 25Hz의 프리퀀시로 일단은 시술을 하겠습니다. 고개 살짝만 돌려볼까요? 자, 시작하겠습니다. 자, 어때요? 괜찮아요?
네.
오케이. 자, 그러면은 일단은 그 애플의 토닝 팁을 이용한 시술을 할 때 여러 가지 팁들이 있습니다. 일단은 우리 시술의 목적 자체가 어떤 열을 최대한 많이 전달을 해주고, 그리고 그 열을 바탕으로 해서 어떤 피지선이나 이런 피지 액티비티 이런 것도 조금 줄여주고 하는 그런 목적이 있기 때문에 일단은 열을 충분히 올리는 것이 가장 중요합니다. 그래서 열을 충분히 올리기 위해서는 가상의 구역을 만들어서 그 구역을 치료를 집중적으로 좀 해주는 게 도움이 됩니다. 왜 그러냐면은 이제 한 구역을 너무 넓게 잡고 치료를 하다 보면은 온도가 충분히 올라가지 않는 상태가 되기 때문이죠. 네, 그래서 구역을 잡고 시술을 진행을 합니다. 토닝을 할 때 어떤 그 팁과 그 다음에 이 피부와의 거리 이런 것들에 대해서 궁금해 하실 수 있는데, 일단은 A 플러스 레이저는 콜리메이티드 빔을 장착하고 있기 때문에 약간 좀 떨어져서 시술을 하더라도 괜찮습니다. 그런데 그렇지만 그래도 최대한 우리 피부를 스치듯이 지나간다는 그런 느낌으로 시술을 해주면은 조금 더 많은 열 전달을 해줄 수가 있을 것으로 생각이 돼요. 자, 이제 방금 500줄을 넣었고, 이제 앞으로 300줄 정도를 한쪽 얼굴에 더해서 일단 한쪽 얼굴을 800줄 정도를 시술을 하겠습니다. 그래서 토탈 한 1600줄 정도의 시술 양이 될 거예요. 자, 지금 이렇게 좀 뜨거움 느껴지나요? 어때요? 열감이 느껴지나요?
네.
자, 우리 하나도 안 아픈 게 0점이고, 그 다음에 진짜 많이 아픈 게 10점이라고 하면은 지금 통증이 어느 정도예요?
3점 정도요?
3점 정도. 그러면은 우리 지금 마취 안 발랐잖아요, 그죠? 네, 마취 안 발랐는데 3점이면은 뭐 할만한 것 같아요, 그죠? 오케이, 좋습니다. 구역을 정해서 이렇게 젠틀하게 그 핸드피스를 움직이는 그런 모션 자체는 이렇게 서큘러하게 움직이는 그런 방법도 있고요. 아니면은 이렇게 직선으로 움직이는 그런 방법도 있습니다. 항상 그 오른손으로는 시술을 하고 왼손으로는 이제 환자의 피부를 만져서 온도가 어느 정도 올라가는지를 체크를 해주는 게 중요하고, 또 이거의 목적 자체는 지나치게 온도가 많이 올라갔을 때, 물론 이제 이 토닝 모드로 화상을 입힐 확률은 상당히 떨어집니다. 그렇지만 그래도 온도가 어느 정도 과하게 올라갔을 때 우리 손가락에 그 쿨링 효과가 있을 수가 있기 때문에 저는 항상 먼저 가면서 시술을 하는 편입니다. 그 다음에 이제 환자분이 지나치게 뜨거워하는 경우들이 있어요. 지나치게 뜨거워하면은 그거는 이제 해결할 수 있는 방법이 일단은 에너지를 낮추거나 아니면은 이제 프리퀀시를 낮추거나 아니면은 무빙 속도를 좀 더 빨리 가져가면은 그러면은 환자의 그런 불편함 이런 것들을 조금 더 줄일 수가 있습니다. 예를 들어서 좀 더 천천히 가면은 아무래도 좀 더 뜨거움을 많이 느끼시는 경우가 많아요. 그래서 그런 그 세세한 조절, 일단 환자분이 뜨거워한다 그러면은 일단은 속도 조절을 먼저 해보시는 게 좋을 거고, 그 다음에 그래도 뜨거워한다 그러면은 에너지를 좀 낮추거나 아니면은 이 프리퀀시 자체를 조금 낮춰서 시술을 하면은 도움이 될 수 있을 것 같아요. 지금 이제 1400줄 정도 시술을 했습니다.
시술 자체는 굉장히 간단합니다. 네. 그래서 젠틀하게 이렇게 이동을 하면서 열을 충분히 올려주는 것이 시술의 목적, 그리고 시술의 처음이자 끝이라고 볼 수 있을 거예요. 자, 이제 방금 나타난 소리가 이제 1600줄. 네, 보통 저는 이제 성인 여성 같은 경우는 뭐 한 1200줄 내외에서 성인 남성 같은 경우는 1600줄 정도까지, 아니면은 좀 더 많이 하는 경우들도 있기는 있습니다. 얼굴에 전체적으로 여드름이 많고 할 때는 그렇게 시술을 하기도 하고. 그다음에 이제 M2 모드로 넘어갈게요. M2 모드는 스팟 형태로 한 이제 7Hz 정도로 연속적으로 조사를 하는 그런 거고, 아까 강의에서 말씀을 드렸지만 애플 레이저의 가장 큰 장점은 DCD가 없다는 겁니다. 이게 뭐 장점이자 단점이 될 수도 있는데, 자, 염증이 있는 데다 일단 써 볼게요. 어때요? 많이 아픈가요?
조금 따가워요.
조금 따가워요. 아까보다는 조금 더 아프죠. 네. 그래서 이렇게 염증이 심한 부위에 스탬프 형식으로 찍어서 해주는 그런 시술입니다. 그래서 그러면 염증이 조금 더 빨리 가라앉는 그런 느낌이 좀 들기도 하고, 보통 뭐 2패스에서 많게는 뭐 3패스 정도 염증이 심한 부위에 이렇게 찍어준다는 느낌으로 시술을 해요. 그래서 다른 경쟁 그 장비들에 보면은 DCD를 가지고 있죠. 네. DCD로 이제 에피더미스를 쿨링을 해서 뻔을 입지 않게 만드는 그런 장점이 있는데, 제가 강의에서도 말씀을 드렸지만 그 DCD 자체가 좀 오히려 역설적으로 뻔의 위험성이 좀 있어서 조심해야 됩니다. 네. 그래서 차라리 저는 없는 게 좀 더 낫지 않나라는 생각을 해서 애플 레이저를 아주 잘 사용을 하고 있습니다. 요거는 저기 0점부터 10점 정도면 어느 정도 줄 수 있어요?
4점 정도.
4점. 아까보다는 좀 더 아프네요. 자, 이렇게 뭐 가볍게 치료를 합니다. 자, 지금까지 썼던 거는 이제 큰 스팟 사이즈 8mm 사이즈죠. 예, 토닝 팁이었습니다. 그리고 이제부터 어떤 그 클로스 코메돈 를 치료를 하는데 이용을 할 그런 팁은 스팟 팁이고요. 그래서 교체를 할게요. 자, 스팟 팁이 장착이 되었습니다. 스팟 팁 같은 경우는 이제 다이아미터가 1.5mm예요. 1.5mm라서 아주 작은 스팟 사이즈로 상대적으로 조금 더 높은 플루언스의 그런 에너지를, 그다음에 낮은 프리퀀시로 치료를 해주게 되겠습니다. 저 같은 경우는 좀 오버해서 치료를 하지는 않는 편이에요. 그래서 일단은 50mm 줄로 3Hz 정도 이런 그 면포가 있는 데다가 치료를 하겠습니다. 어때요? 요거는 좀 따가워요. 요거는 0점에서 한 10점 정도면 어느 정도 줄 수 있을까요?
4점.
4점. 네, 아까랑 비슷하네요. 결국은 전반적인 이 시술 자체는 3점에서 많게는 4점 정도. 참고를 해야 될 게 전혀 마취를 하지 않았습니다. 네, 마취를 하지 않았다는 거. 그리고 이게 이제 하고 나면 한 일주일 정도, 좀 오버해서 치료가 되면은 일주일 정도 붉은 자국이 남는 경우들이 있어요. 그래서 처음에 익숙하지 않을 때는 가급적이면은 좀 보수적으로, 그래서 에너지도 조금 낮추고 보수적으로 치료를 해도 꽤 효과는 좋은 편이거든요. 그래서 너무 많은 패스 지나가지 않도록 좀 주의를 해 주십시오. 효과가 적으면 다음에 또 해주면 되니까요. 이 정도로 일단은 마무리하고 여기서 주의사항이 하나 있어요. 이제 스팟 모드의 플루언스를 토닝 팁을 끼고 쏘게 되면은 전혀 문제가 생기지 않습니다. 왜냐면은 그 단위 에너지 자체는 굉장히 낮기 때문에. 근데 반대로 이제 스팟 팁을 낀 상태에서 토닝 모드의 그 에너지를 쓰게 되면은 그거는 100% 뻔을 입어요. 그래서 항상 그 스팟 치료를 하고 난 다음에 저는 습관적으로 무조건 바로 즉시 토닝 팁으로 바꿔준 채로 마무리를 짓습니다.
Thank you, Dr. Rhee, for the presentation and the video demo. Now we will enter some questions. There have been a few questions on the live chat from the participants. I will read it to you. The first question is from Dr. Kishanti. How is the risk for the post-inflammatory hyperpigmentation for type 3 to 4 Fitzpatrick skin type when using this kind of diode laser?
I think it's almost zero, because if you use it just to heat the skin, there is very low risk of burn. And if there is no burn, there will be no post-inflammatory hyperpigmentation. But if for the tightening, if you give just gentle heat, there is almost no risk of post-inflammatory hyperpigmentation. And if you treat for the acne lesions, then it's the post-inflammatory hyperpigmentation following the acne lesion is not from the laser treatment, but just from the inflammation, I think.
Okay, so this kind of laser is safe to use in countries like our country where we have many Fitzpatrick 3 to 4 skin types, yeah?
Yeah, I think so, because the 1450 nanometer wavelength has very minimal affinity to melanin, so it has very low risk of burn and also the hyperpigmentation.
Okay. And another question from, again, Dr. Kishanti. Can we use this for the acne rosacea type? Does it work well as well?
The acne rosacea type, I've tried, and yeah, they're very hoping results, should I say? Yeah, it works. And but I would not use it for very severe rosacea ones, because the severe ones would be aggravated with heat,
Okay.
So I would rather use other ones.
Okay, but does it work well to at least reduce the redness for the acne rosacea?
Not for the
experience.
Redness. Not for the redness, for the inflammations.
Only for the inflammation.
Yes.
Okay.
For the redness, you should use other kind of lasers like pulse light lasers or long pulse 532 KTP lasers or IPL. Yeah.
Okay. And another question from Dr. Maria Angeline. Dr. Rhee, how long is the interval between sessions, and can it also be combined with ablation laser?
Yes. So the frequency or the time gap between the session should be like a week. So you can do it twice a week. It's okay. And but I do generally once a week, so 1 week apart. And you can mix it with ablative lasers, but I would first use A+ laser, the non-ablative one first, and then I'll move on to the ablative lasers. And that's what I do for the treatment of acne scars. So I usually use for the ice pick scars, the ice peak scars, you use TCA cross, chemical reconstruction of skin scars, right? So to enhance the effect of cross technique, I usually use the A+ laser just after the cross treatment, because the A+ laser would impair the sebaceous gland activity, and it will make more scar. So when we want to treat the acne ice peak scar lesions, we should make more scar. So we should make wound and impair the normal wound healing. And I think the A+ laser helps to impair that normal wound healing. So whenever I try the ice peak scars, I try TCA cross first, and then I do the A+ laser treatment, and then I move on to another kind of laser treatments like erbium YAG laser ablations or picosecond laser treatments, or subablative radio frequency treatments. So you can combine between the A+ laser treatment with other ablative treatments, but I would do the A+ first and then the ablative one next.
So can it be done on the same day, or we have to wait?
No. I'll do it on the same day. It doesn't matter.
On the same day straight away, yeah?
Yeah, but you should, for the darker skin types, you should be aware of the risk of the post-inflammatory hyperpigmentation because of the ablative ones, right?
Okay, yeah. And another question, Dr. Rhee, is it true that the target for the treatment is to hit the skin, like what you said?
Is it true?
Yeah. Did I get it correctly? Like the purpose of the treatment is to uniformly hit the skin to reduce the inflammation?
Yeah, sure. So because the target chromophore is water, so when you irradiate 1450 nanometer wavelength, it will heat up skin from epidermis to dermis.
For the temperature control in the video, I see that you are using only your touch to feel the patient's skin. Can we use the infrared thermometer? Like maybe if we can get precisely to what temperature should the skin be to achieve the correct heat that we are looking for?
Sure, why not? but it's because it will be more accurate if you use those kind of infrared devices. And in my experience, but it was just okay to use my left finger to feel the temperature, and then you can feel the patient feel some discomfort. Then I reduce the frequency, or I move faster to hit more slowly. Would it be correct answer?
How hot the temperature skin should be that we aim for, if we can measure it?
How hot? Well, near 40, 42, 40, 42, 43.
Okay, so it should be up to a point where we can feel that it is quite hot in the skin, yeah?
Right.
Okay. And in your experience, how many sessions usually in average it is needed to clear up the acne? Like we can see that some respond well, some doesn't respond well. Like how many sessions can we tell patients to wait for the result?
Okay, I recommend the patient to do the treatment at least 10 times. 10 times.
With 1 week apart?
Yes, so it will be 10-week program, and the photos, the clinical photos that I showed you was only for the treatment with the A+ laser and the smart looks LLT, right? And if you combine with other kind of devices like long pulse KTB laser or the pulse light lasers, then the effect should be more faster, quicker treatment effect would be achieved.
Okay.
So I recommend the patient to do at least 10 times.
At least 10 times.
Mhm.
And does it give long-lasting results after the patients have done 10 sessions? The control of the acne lesions, is it quite long-lasting?
Oh, so I'll tell you the interesting thing that I heard today. So do you remember the show host that didn't respond well? And
Oh,
I
yeah,
heard,
yes.
yeah, yes, and she said after 2 or 3 months, the acne lesions have been more improved.
Oh, okay.
And not right after the treatment, but so not just right after the treatment, the effect was not that satisfactory. But after like 2 or 3 months, the acne lesions suddenly improved. So and the studies show that the smooth beam, another 1450 nanometer wavelength laser, has an effect of 12 after follow-up of 12 months, the effect was well maintained. But I doubt it works that long. But in the patient with very good response, so it has some prolonged effect, like when we take isotretinoin pills. When we take isotretinoin pills for a certain amount of certain period of time, then even though we treat the isotretinoin pills, then the acne lesion doesn't come out, right? Like that, likewise, when we treat sufficiently, then the effect can be prolonged, like for 6 months or 12 months. And for because I have used it for just 1 year and 1 year and a half, so I can't tell it works for over a year or so. But the patients are satisfied with the prolonged effect. But I cannot tell you it works like 3 months, 6 months. It depends on the patients, but it sure has prolonged effect.
And once the result, like if the patient feels like the result is diminishing, should we start again with the 10 sessions, or we just start with a few sessions?
You can either start with a few sessions, or if you have very good affinity or rapport with the patient, then we can start another 10 treatment sessions.
Okay, like the first protocol, yeah?
Mm-hmm.
Okay. And Dr. Rhee, it also, like with the show host, it is very interesting that she's one of the non-responder in your previous one, but then you said that she got results after 2 to 3 months.
Yes.
Like, can we predict like what kind of conditions will be for the patients that? Can we predict the one who can respond well or the one who don't respond well in the beginning of the consultation session?
I think that's related to the personal habits. You know, acne lesions, acne are very related to the habits. So lifestyles. So if the one has really bad lifestyle, then it wouldn't respond much like her.
With heavy makeup,
heavy makeup, and who has to cleanse it every day very vigorously, or the one who has stresses, many get too stressed, then the acne would come out. and those who doesn't sleep much, or those kind of lifestyle is the one that predicts not good effect or good responders. But yes.
Okay. We have some more questions
Mhm.
from Dr. Julia. Dr. Rhee, the 1,450 diode should be reduced sebaceous gland size. Does it permanently affect the size of the sebaceous glands? In your presentation, you said that this laser can reduce the size of the sebaceous glands.
Right.
Does the reduction in size is permanent?
Permanent. I don't
Yeah.
think it's permanent. It's not permanent, but so if you impair the activity, then the size would come out. The size would grow. But if you destruct it, then the effect would be permanent. But I think the for the ratio, the acnes, the insulated
RF,
radio frequency, yes, it would destruct it because it exerts very high energy in a very short time. But I think the 1450 nanometer laser can destruct it, but the portion is very small, I guess. It's for the impairment rather.
Okay. Not the destruction, but only the impairment of the sebaceous glands. Okay.
Or if you use the spot treatment for each sebaceous glands, then it could destruct it, but there can be side effects, right? So I wouldn't recommend that. I would just impair it, and I will modulate the activity of the sebaceous glands.
Okay. And another question from Dr. Maria Angeline. Should there be a maintenance session for this treatment?
Well, if you maintain like in 2 week apart or a month apart, it will work well, I think. It's just like when you take isotretinoin pills. We do the loading. We need some loading dose. So we take like 1 or 2 pills every day for like 3 months, and then if the acne goes away, then we reduce it like one pill per day or 1 pill on another day. So if you do the treatment every week first, and then you can increase the interval to 2 weeks or the 4 weeks.
Okay. We'll check some more questions. Okay. Dr. Rhee, maybe you can share with us, like in your experience, what is the difference between we have some acne pills also using the chemical peelings to reduce what is the difference between using peeling and using the laser, in your opinion or in your experience?
Well, I use peels as well with the laser treatment as well. The peeling is for the treatment. What I think is the chemical peel is for the treatment of the keratinization. So we reverse the abnormal keratinization to a normal one. And the laser is for the activity to reduce the activity of sebaceous gland. It is the main portion, and the chemical peeling is for the main portion is to reverse the abnormal keratinization. And the laser and the chemical peeling both works well for the inflammation, I think. And then sebum production, inflammation, and the P acnes. I think the laser and the chemical peeling, like Jessner Coombs solution, can work both well to the to reduce the C acnes. Yes, so the main mechanism is different, I think, but they have some synergistic effect when it is combined.
Okay. And how do you combine the pills and the laser? How many intervals apart between the
I do
two?
it same day, in the same day.
Oh, which one you do first? You do
I
the laser first?
Yes, I do laser first, and then I do the chemical peeling, and then I generally recommend to for the patient after laser treatment. I almost always do the medical skincare like vitamin C, iontophoresis, or ionzyme. So so the protocol is when I usually extract some of the comedones or some of the inflammatory lesions, and then I do the A plus laser treatment, and then I do the chemical peel, and then I move on to the iontophoresis,
Okay.
and then some of the LLLT.
Okay. Another question from Dr. Julia. Do we still need, Do we still need to do komedo extraction when using this laser? And can we use this laser for patients with dry skin?
So as I showed you, it didn't increase it didn't increase the level of transepidermal water loss. So it doesn't have any effect on the skin barrier. So I think it is very safe to use it on the dry skin. And another thing I want to talk about is that dry skin is not in opposite to oily skin. Dry skin is the meaning that the skin has little water, and the skin has little capacity to attract water. And the oily skin is the meaning that the skin has too much oil or sebum. So dry skin and oily skin are not opposite concept. And as the 1450 nanometer wavelength A plus laser didn't increase the epidermal water loss, then so I think it's safe to use it on the dry skin. And for the komedo extraction, some of the young patients can't afford to, doesn't like the pain that with following the comedone extraction. So it is better to extract comedones or extract inflammatory lesions first. But if the patients can't tolerate those procedures, then I recommend to use the small spot tip to treat the comedones without extraction. It is possible.
And if we do the komedo extraction, you suggest it is before or after we do the laser?
I recommend it before the laser treatment.
So we do the komedo extraction first, like a medical facial, and then after that we do the laser on the same day.
Right, and then I move on to chemical peeling and then iontophoresis.
Iontophoresis, and for the iontophoresis, you always use vitamin C for the serum.
Yes, it is generally based on the vitamin C and vitamin A as well. But vitamin C has an effect of to reduce the redness, when it has a whitening effect, and then the vitamin C can reduce the level of IL-1 alpha, which is related to the creation of the microcomedones. So I always recommend to the patient to do the medical treatment, especially based on the vitamin treatments, vitamin C especially.
Okay, and another question from Dr. Julia. For the inflamed lesions, do we still need to do the corticosteroid intralesion injection when using the laser?
For what lesions? For inflammatory.
For the inflammatory lotion.
I recommend to. I like to inject triamcinolone injections to the inflammatory lesions. Even if I do the laser treatment, it is because that when you have a long time of inflammation, then the lesion has a tendency of scar. So if you have a inflammation for a longer period of time, then it is it has tendency to make more redness. Redness persists longer, and it has tendency to make some depressions. So I try to reduce the inflammations as fast as possible with all tools that I can apply. So I like to inject triamcinolone every time when the patient has inflammation on their face.
So after doing the laser, we do the injection?
I would recommend I will do the laser and then I'll inject it later, because triamcinolone injection has water as well in the lidocaine. So I think I can't expect the result.
Okay.
The result can be more aggravated. So I would do the injection later after laser treatment.
Another question from Dr. Maria Angeline. Dr. Rhee, is there any indication for 1,450 diode to create PIH with the post-inflammatory erythema? And on that condition, how do we treat if the hyperpigmentation is in the form of an erythema? Can this diode laser be effective for that?
You're asking that would 1450 nanometer wavelengths would work for post-inflammatory erythema, right?
Yes.
Okay, so we must think what the post-inflammatory erythema what condition is underneath the post-inflammatory erythema. There will be some of the wound healings, and there will be some of the inflammations, and there will be some vessel proliferation, and that's why the acne marks are red. So when you do the 1450 nanometer wavelength treatment to the red acne lesions, it would somewhat reduce this inflammation, and it will help the wound healing, but it won't affect the vessel proliferation directly, but indirectly, the 1450 nanometer wavelengths can promote wound healing. So I think it helps. It will help. So that's why we use the toning technique to try to treat the whole face, even if there is no lesions, and even if there is just acne marks. But when you treat with this 1450 nanometer wavelength diode laser, it will reduce the inflammation, and it will reduce the sebum secretion, and it will promote somewhat wound healing. And there are many reports that the smooth beam was used for the treatment of depressed acne scars as well.
Okay, but for the erythema, you suggest that we combine it with another type of laser or any other modality.
Right. Yeah. It's not the right one, but it helps. It would help. But and the gold standard would be pulsed laser, right?
Yes.
And if you don't have pulsed laser, then you can use 1450 nanometer wavelengths to improve those kind of acne marks.
Okay. Thank you so much, Dr. Rhee, for your sharing on your experience and on your precious knowledge, and thank you for answering all our questions.
Thank
Now
you.
we have come to the end of our session, unfortunately, and we have to close this session.
Okay.
So thank you for all the participants for joining our session today. Thank you for those who are actively asking questions so we can get more knowledge and more experience together from our speaker. And we would like to thank you so much, Dr. Rhee, for joining us in our session today. Wishing you health and safe there in South Korea.
Yeah, thank you. You stay safe and healthy as well. Thank you.
Yes, thank you.
Thank you.
Thank you for participants. Don't forget that we have another